You know, a lot of people ask me, how serious is snoring? How serious is sleep apnea? How important is it to get a good night's rest? Well, I'd like to think about some of the risk factors that indicate to us that a patient may have sleep apnea, and then tell you quickly some of the easiest ways to treat it. Well, the first is, do you snore? That's a risk factor, okay? Are you tired? Has anybody ever seen you stop breathing or gasp for air while you're sleeping? Do you have hypertension, GERD, arrhythmia, or any of those other comorbidities that we often see associated with obstructive sleep apnea? Then are you overweight? Are you over 50? Is your neck size 15 or larger for women or 17 or larger for men? And then finally, are you male? Anytime we have three of those risk factors, that person is possibly going to be suffering from obstructive sleep apnea. When there's 4 or more, there's a 92% probability, based on the risk analysis, according to Chest Magazine, the American Thoracic Society journal, that that patient has obstructive sleep apnea. We still don't know for sure. We'll need to do an at-home sleep test. Occasionally, it still has to be done in the clinic, but today the far majority, the vast number of those sleep tests are done at home. Once that's done and a diagnosis is rendered by a board-certified sleep physician, then if you're mild or moderate, you certainly have an option of an oral appliance or a CPAP mask. The oral appliances are known to be very easy to wear. CPAP masks are a little bit more of a challenge, but the CPAP masks do work just about all the time if the patient can tolerate that. If they can't, oral appliance therapy works about 90% of the time for mild cases, over 80% of the time for moderate cases, and then drops down to about half the time it's effective for patients who have severe obstructive sleep apnea. So in the case of severe sleep apnea, we'll still recommend trying a CPAP mask unless you can't wear one for some reason. So those are the risk factors, and those are the basic treatments we have for helping patients get a better night's sleep, feel like they have more energy, reduce some of their comorbidities and improve their health outcomes, and maybe even quit snoring. And that's what we'd be able to do for you.